This is Share the Vision, presented by the Resource Center, a discussion of the programs and services of the Resource Center and about issues related to individuals with disabilities. Today we preview for you on radio the brand new, fully renovated dental clinic here at the Resource Center in Jamestown at 890 East 2nd Street. I stand with Steve Watterson, Community Relations Director at the Resource Center, to introduce today's program. Steve, open wide.
Hi, clever Dennis. How are you?
I'm fine, thank you, and it's a joy to be here at this beautiful place.
Yes, the Resource Center has operated dental offices out of this facility for probably 25, 30 years. But we just underwent a major renovation, all new operatories and equipment and stuff that I wouldn't even know how it works. But we're happy to have that, and we're also pleased that we have two brand new full-time dentists here at our practice, so we're going to be meeting them during the course of today's show.
Oh, I got to make sure I brushed after lunch. Okay, I'm in good, so I think I'm okay to meet some dentists. But some other things to say first. This is not our first visit here. We spent a few minutes here briefly, just a short time ago, with Carissa McKinney, one of the dental hygienists who works in association with the school-based health center operated by the Resource Center at Jamestown High School. And I was wowed when I walked in here for that little interview with her. This is really some glorious place for dental work.
Yeah, the space it's all brand new. It's very it's modern, state-of-the-art, and it's just fantastic. And the only problem with radio is that we can't give people a visual of what it looks like, but we'll hope to paint a virtual picture for them.
But the office manager is here, and I'll have you introduce me, and we'll start that tour.
This is Brandy Oakes, who's going to be the first person you're speaking with.
Brandy Oakes is the office manager here at the Resource Center's dental clinic. I'll sit down and say hello. Brandy, thank you for spending a few minutes on the radio with us today.
Thank you, Dennis.
Now, we are at 890 East 2nd Street, and when was the renovation completed at this facility?
We began using the new operatories in November.
What's that word again?
Operatories.
Does that mean a little room that we go into?
Yes, it does.
And Steve suggested to me that you really have state-of-the-art gear here. What is state-of-the-art about what you have done? Let's describe the facility for the listeners.
Well, we have all up-to-date, modernized equipment. We have added a pan x-ray machine, which has made it much easier for us to get x-rays on patients that we weren't able to obtain them on previously, because they might not be able to sit still for a long period of time. This machine goes actually around their head and takes a picture of their whole mouth so we can see all their teeth. And so that's been a great addition to the new operatories. We also have added a Hoyer lift for our patients that are wheelchair bound, that are unable to, previously they were unable to get into the dental chair. And now they can get into the dental chair with a Hoyer lift and have their dental work completed comfortably rather than in the wheelchair.
Have your dental work completed comfortably. You know, I'm sure, and many listeners, even just the phrase dentist's office, they get a little uncomfortable.
Yes.
But what struck me as I have looked through your place, now this is my second visit here, as I said at the outset, is one, how beautifully done and inviting the rooms are, how comfortable the furniture, the chair that I'm going to sit in looks. This is really an inviting space for the patients to come into.
Yes, it is.
Colorful.
It is very colorful. We've had many compliments on the whole new clinic, the new providers, all of our providers. We really just have a good team here working together.
The other thing that appealed to me as I took my tour here, Brandy, was that it's obviously built for efficiency and so that you can see many patients. You have a lot of rooms or operatories, as you refer to them. But there's also the appropriate level of privacy as well for the patients.
Yes, the architecture was done just perfectly. So, as you mentioned, the privacy is almost perfect, but it also makes a good team where the assistants can get from one room to the next very easily without having to go in and out. So that's been nice also. I
understand that two of your dentists, full-time dentists, are here, and we're going to meet them in just a few minutes. But tell me about the entire staff. There's you, two dentists, and who else?
Well, we actually have myself, the integrated site manager. Dr. Veazey is here at the Jamestown Clinic 2 days a week. He practices at our Dunkirk Clinic 2 days a week. Dr. Oliver is here full-time, 4 days a week. He's here until 7 p.m., which is working out great for a lot of our working patients that want to come after work. And then we have Dr. Bowman, who works 3 days a week. So we actually have 3 dentists. I have 3 hygienists, and then we have a team of 5 assistants, dental assistants working with us.
Now let's get someone into the practice here. If they don't have a dentist now or have never seen one, can they call you and make an appointment? How do they initiate coming to the dentist here?
Well, this is actually perfect timing because we've had a backlog of new patients, being that we're one of the few places in the area that accept a managed care. We've had a lot of patients calling and trying to get in, and we didn't have the providers and the space to see the number of patients that we were wanting to see or the community needed. So as of Monday, we are going to be accepting new patients again on Monday, March 13th. So yes, all they need to do is call us. We'll obtain all their insurance information or demographics information, see what's going on with them, and get them right in to see one of our dentists.
Do patients need to have insurance in order to come?
A patient does not need to have insurance to come to our clinic, no.
Mm-hmm. Now, are all the insurances accepted here, or most, or is that a discussion that people should initiate when they call?
Most insurances are accepted. Some insurances we don't participate with, but we will bill their insurance as a courtesy to the patient. We also do offer the sliding fee scale for patients that don't have insurance that might need some financial assistance. There's unlimited options for patients to get care here.
And if patients are on Medicare or Medicaid, those are words that are thrown around quite often, they can be seen here as well?
Absolutely, yes.
What's the number to call?
661-1431.
I'm going to get my pen out here and write that down and see if I remembered it right. 661-1431?
Yes.
Okay. One more time, listeners, 661-1431. And we emphasize that because dentists, as you say, it's been hard to find one around here.
Yes, it has. And I have a waiting list of people that I'll be calling also in the next day or two. So it is hard. It's hard to find dentists in this area that accept a lot of the insurances that our community has and need the dental care for.
So this must be very exciting, not to mention hectic, but very exciting for you as the manager here, the site supervisor, to have this robust, growing clinic.
It is. I'm very excited to see what 2017 has in store for us.
How did you get into had you had an eye on dentistry or this kind of work your entire career, or did you just kind of find yourself running a dental office? Tell me a little bit about you, Brandy.
I did. I started at the Resource Center 13 years ago in the finance department, worked my way through the finance department, and then came over to the program probably 2 years ago, just supervising the front desk staff at the clinics in the North and South County. A position came open here at the Kappa Clinic for the dental manager. And so I just happened to step into there. I did not envision myself in a dental clinic, but I absolutely have enjoyed being a part of this whole renovation. And
how long have you been the site supervisor here?
I have been probably about 9 months.
So what have you learned? This is quite fresh for you. What have you learned about dentistry, about teeth, about care? Is there anything that really stands out to you as you've been immersed in this now for a brief and intense period of time, Brandy?
I have learned quite a bit. I never imagined myself working in a dental clinic, as many people have a fear of dentists, going to the dentist. But I've learned that it's not fearful here. We're welcoming. The atmosphere is welcoming. Our people are welcoming. I myself have even assisted dentists in time of need, so I've learned a lot, being chairside, cleaning instruments. I've learned quite a bit that I never imagined I would be learning.
We're going to meet a couple of members of your staff here, a couple of the dentists who've set aside some time for us. So who do you think that we should go and see first here, Brandy?
I think Dr. Veazey would be a great one to see first.
Brandy Oakes at the Resource Center's Jamestown Dental Office at 890 East 2nd Street. She could have just as easily suggested we speak with Dr. Courtney Oliver first. He's another new dentist at the Resource Center. But she suggested Dr. William Veazey. And since his last name is a little unusual, let me spell it for you before we get to the interview. Veazey. Dr. Veazey, thank you for taking a moment to say hello to us.
Oh, my pleasure.
You are about to go and see some patients here, so we won't keep you long. But tell us a little bit about your work here at the dental clinic at the Resource Center and a little bit of your dental background. How long have you worked here?
I've worked here since the beginning of December.
Oh, well, you're brand new then.
I am brand new. So far, so good. It's a wonderful place to be.
Welcome to Jamestown. Is this your home community, or did you come from elsewhere?
I moved down from the Rochester area, where I practiced in Rochester and in Buffalo.
And you are a native of Western New York or elsewhere?
I am a native of Mississippi. I was born and raised in Mississippi. After I graduated from dental school, I went on to active duty in the Navy and traveled around the world and decided to keep exploring.
What motivated you to become a dentist in the first place, Dr. Veazey?
I enjoyed taking care of people. I did some care work at the time. I wanted to teach, and I was teaching part-time in a chemistry lab while I was in college. And my organic chemistry professor recommended that I apply for dental school, and the rest is history.
You are enjoying Jamestown so far, it sounds like.
I like Jamestown a lot.
I would like to have you speak for a moment about the facility here, because when I take a look at it, and I'm not a dentist, I'm just a person in the chair a lot of the time, it looks like a beautiful, a very efficient place to practice dentistry.
It is remarkably efficient, and most of our equipment is brand new. I don't think some of it had even been used when I arrived. It was so new. The clinic was recently renovated. We use the latest and greatest materials and the latest techniques. So we're afforded the opportunity to practice high-quality dentistry.
One of our purposes in doing this radio show today is to encourage people out in the community who may not have a dentist or recently lost one for reasons of retirement or whatever, to consider coming to the Resource Center for their dental work, their regular dental appointments. Tell me a little bit about your approach to patients and how you like to interact with them, Dr. Veazey.
My approach is aggressive prevention. I would rather see you twice a year, tell you that you don't have cavities, and then say hi to you at the grocery store. If you do need work done, we're more than capable of doing it to get you to that point. But I think my goal is to get your treatment done so that you don't need any filling, so that you're cavity free, and that you just have a pleasant experience in the hygiene chair, and I come by and do an exam, and then everything's great.
Aggressive prevention amounts to what, from your perspective and from the patient's perspective?
Aggressive prevention means to get you in, hopefully, before you ever have any cavities, and to keep you cavity-free throughout your entire life. We see children essentially from the time their teeth start erupting through the gums. That's when you can really start preventing cavities from forming in the mouth.
What are the parts of aggressive prevention on behalf of the patient? In other words, what should we be doing to meet your expectations, doctor, in terms of taking care of our teeth?
By and large, I recommend just a couple of things just to make it easy. I recommend that most everyone use a sonic toothbrush and brush around the gum line, and use a fluoride rinse on a daily basis just to help to keep your teeth mineralized. Enjoy your candy, enjoy your coffee, then brush your teeth afterwards.
What's a sonic toothbrush, just so that I understand exactly what you're talking about here?
A sonic toothbrush is an electric toothbrush that emits a sonic pulse or a vibration. So it vibrates around the teeth, and it helps to break up the debris that gets caught between your teeth, because most people, although they're good in character, they just don't floss on a daily basis. And I recommend, instead of chastising you for not flossing, to just get a sonic toothbrush and brush around the gum line, and it usually does as good of a job as flossing.
Confession's good for the soul. I've never used one. So does this force water out too, or is it just the sonic vibration? Tell me how it works.
It does not force water out. It's a toothbrush with an electric gizmo in the handle that vibrates at a very fast rate. And so you brush your teeth just like if you were using a power tool. You don't put pressure on. You just gently brush your teeth. It's very gentle, and it does a much better job than a manual toothbrush.
And it has a brush aspect to it as well.
It does.
One other thing, Dr. Veazey, what's on the cutting edge in terms of the things that are new and exciting in dentistry that are just arriving or you see on the horizon that might change the practice, might improve our dental health? Is there anything that's just coming in now that's really exciting to you?
One of the greatest things I think in dentistry right now is some of the newer materials bond to the dentin and the enamel of the tooth without having to use the glues and the bonding agents that we use. And it gives more of a natural interface, more of a biological interface, if you will, than the organic chemistry that we use right now.
So teeth under repair are getting a better resurfacing than they used to get.
They're getting a better resurfacing. The fillings seem to leak less than some of the older materials that we've used for many years. And so it's exciting to see where this is going.
Dr. Veazey, thank you very much. Wonderful to meet you, and we hope that this encourages people to contact the dental clinic here and perhaps make an appointment.
Well, thank you very much.
There are 2 full-time dentists here at the dental clinic at 890 East 2nd Street in Jamestown, from which we broadcast today. You just met one, Dr. William Veazey. Now it's my pleasure to introduce to you Dr. Courtney Oliver. Dr. Oliver, hello. Thank you for joining us on the radio today.
Thank you so much for having me. I really appreciate your time.
Now, Dr. Veazey told us that he had not been here very long. This is also a new place for you to practice dentistry.
That is correct. So I've been here approximately about 3 months, and so just new to the Jamestown area.
Give us a little bit about your background and your work as a dentist.
No problem. So I'm originally from the Seattle, Washington area, just outside of Tacoma. I actually did my residency at St. Elizabeth in Washington, D.C., and then after that I actually ended up coming up here. So, yes, relatively new to the area.
How are you enjoying it so far, being in Jamestown, working at this clinic?
Getting used to the snow is one thing. But other than that, it's really fun. I think the people in the community have welcomed me with open arms, and that's been wonderful.
As someone new coming into this as a practitioner, as a doctor, let me have you turn your perspective around 180 degrees and address new patients in terms of what it might be like to come here, and tell me a little bit about your work and how the clinic operates here.
Yes. So usually what ends up happening for our new patients, what we try to do on the first visit is just basically introduce ourselves, getting them used to the staff, the facility, and then us as the provider. So that's going to be usually the first appointment. After that, what we normally do is we talk about the patient's needs, what it is that they would actually like to get done, and where they see themselves going in terms of their oral health overall.
And then how often do you like to see patients?
Usually we like to see patients if they need some work done. We usually try to get them in at least 2 to 3 times a month, depending upon our schedule and our availability. So I'm a new dentist, and so I do have some openings here and there, and I know that hopefully after this my schedule is going to be filling up a lot faster.
Now, you said 2 or 3 times a month?
Yes. We try to see you at least 2 to 3 times a month if you need multiple work done in different areas. So what we try to do is usually come up with a treatment plan. That's going to be usually on the first visit, see where you're at right now and where you would like to go ultimately.
And suppose we come in and pass with flying colors, then when do we need to come back?
So usually if that's the case, which I know the majority of your listeners are going to pass with flying colors, we're going to have you
The look on his face said something else there, folks.
So usually we'll have you come in every 6 months. And what we do at that point in time, we just do general overall checkups. We check back in with you because at the end of the day, it's about your oral health. And what we're here to do is basically just provide an educational basis, but at the same time, try to get you to a point where you really are maintaining your overall oral health, because that directly relates to your overall general health. And that's the reason why we're here.
What are the general issues that you have seen so far, not specifically, but just among the patients who have come here? What is outstanding in terms of what you have needed to deal with in the clientele?
Usually within the clientele here, one of the biggest things that I'm noticing is a lot of cavities. And mainly that's due to a couple of things. I know that a lot of people like to drink sodas. And so one of the things that a lot of people actually do have is a lot of cavities. But with overall patient education, using fluoride rinses, utilizing toothpaste that actually has fluoride in it, that actually can help decrease that. And that's what we're here for. We're here for the patient education, but also to establish establish and to also try to maintain a level of oral health that is going to be beneficial to the community.
Are there other things that you recommend to your patients long term to help maintain that level of oral health regardless of their age, Dr. Oliver?
Yes. Simply put, one of the easiest things to do to keep from developing oral diseases, and such as cavities, periodontal disease, and then also gingivitis. Simply put, is just brushing at least 3 times a day, and then also rinsing with Act mouth rinse. I mean, there's wide variety of antiseptic agents that you can utilize, but also I try to recommend to patients the basic things, rinsing their mouth out with the warm salt water. That's something simple. It's usually something that patients can do on a day-to-day basis.
Talk to me about your approach to relating to the people, wide variety of backgrounds and ages and problems that they have. What's your approach to meeting a person, getting to know them quickly, and really getting pardon me the phrase, quite physically intimate with them and working with them?
Definitely. Well, the first thing I always try to do, and I was taught, is never treat a stranger. That's the first thing that we actually try to do. We try to get a chance to know the person, because ultimately you're going to feel a little bit more comfortable with me as a provider and you as the patient. It is a very intimate space that we're going to be working in. And so what I try to do, simply put, is tell you where it is that you are now and where we would like to go at the end.
Mm-hmm. And as I spoke to Dr. Veazey, I asked him this question. I'll ask you also. In terms of what you see happening in the world of dentistry today, are there new, exciting things, changes for those of us who've been brushing our teeth for decades? Are there things that are coming down the pike here that are going to change your work or our dental health in a big way?
There are. So there are a wide variety of things that are actually going to be changing here. One of the biggest things that a lot of people are now starting to utilize is stem cell technology. I know that a lot of people have been hearing a lot more about how we're not going to be using necessarily drill and fill dentistry anymore. And that's going to be something that's probably going to be upcoming in the future. And I think that there's so many advances that are actually taking place within the world of dentistry that is going to be changing and shaping overall.
Stem cell, how do they help in the chair?
So usually what's happening right now is there's a wide variety of dental school research that is actually going on. And what they're trying to do is utilizing the body's own cells in order to regrow teeth. And so that's been something that's going to be on the horizon. The research has yet to come to fruition on a day-to-day basis in the everyday practice overall, but there's going to be some advances that are going to be mind-blowing in the next upcoming years.
And is drill and fill still the standard technology for someone who has a cavity, or are there things today that can be done that are different from what might have been done even 10 years ago?
Well, I think it depends upon the level of care that the patient actually needs, okay? So if something is relatively deep, we would say probably it's best to go ahead and remove everything that's there, because it could potentially cause a problem and then further lead to more treatment necessarily. But there are some things that are going to be advancing with the use of fluoride, with the use of a lot of different agents that actually help in maintaining the tooth structure and the stability of it. And what we try to do here as providers is try to catch that early on, allow patient education, and then reinforce that.
Let me see if I've got your recommendations right, because I know you need to see patients soon. One is we should brush 3 times a day, use a rinse, and come and see you twice a year.
Yes, and then also, too, one of the biggest things is flossing. I mean, it's one of the things that are so simple, and I know people have heard this over and over again, but it's some of the simplest things that we can all do that actually help in prevention. And as I was told, an ounce of prevention is, I think, worth a pound of cure. I think that's the biggest thing.
How many times should we floss a day?
Usually, I was going to say I always recommend to my patients as many times as you eat. I know that's difficult for most people. So how do we utilize and make sure that we do that? Instead of putting the floss back in the bathroom, place it in the living room, place it in the family room, place it in areas in which you know that you're going to be snacking or you're going to be eating, and then that kicks off the reminder for you to go ahead and do that.
Dr. Oliver, nice to meet you. Welcome again to Jamestown and the TRC clinic here. We wish you all the best.
Thank you so much for having me. I really appreciate you and your listeners. Thank you.
After having met 2 of the dentists here at the Resource Center, I want to spend just 1 minute with a friend who's made some appearances before on Share the Vision. She says, this is Pam Cranston. Hello.
Hi, how are you?
Fine. What is your work? Remind me again what it is you do here at the dental clinic. Pam.
I'm a dental assistant here at the clinic, and I help the dentists and help keep things running here.
And Pam, you have a substantial career with the Resource Center's dental clinic here.
I'm going on my 24th year.
Congratulations
Thank
to
you.
Well, and you would be the ideal person to comment on this. The new facility here that has just been opened in the last few months and what it's like. Steve Watterson wanted us to give a virtual picture of the place to the listeners. What's it like in your new facility here?
Actually, it's a beautiful state-of-the-art facility. We have a digital x-ray, we have a panoramic x-ray, everything's computerized, and the facility itself is very functional and beautiful.
And very comfortable for the patients, it appears to be.
Absolutely, yes.
So early in the show, Brandy was talking about the fact that even she's was at one point a little reluctant to go to the dentist. This makes it a little more comfortable for people.
Yes, it does.
And you're enjoying the new place here?
It's beautiful and it's very functional. It's very easy to bring patients in and work on them, and it's just very pleasant.
Pam, thanks. Nice to see you again.
You're welcome. You're welcome.
Pam Cranston, dental assistant at the Resource Center's Dental Clinic, 890 East 2nd Street in Jamestown. The site supervisor, office manager there is Brandy Oakes. Randy, we come back to you. We're getting into the final minutes of today's Share the Vision broadcast. And first, thank you. This has been a glorious opportunity to get to know you and some of the staff here.
Well, thank you for coming to visit us.
You put out an offer to the community just a little while ago, kind of an invitation to dental services, and it sold out immediately, except it wasn't selling because it was free. Tell me about this day that's coming up.
So the 8th District Dental Society reached out to the Resource Center quite a few months ago in regards to a grant they had received. They were looking for a facility to provide services to community members who don't have dental insurance, who may not be able to afford to have their dental work done. And so we arranged on March 18th to have a free dental clinic here at our site at 2nd Street. And it was advertised on last Monday, and I believe by Wednesday, all the spots were filled. So very quick turnaround. The phones were ringing. We were scheduling appointments. Very excited about the 18th.
You spoke earlier in the program about the need for dental services and the excitement that you have and that you are in the position to accept new patients beginning next Monday. This is just another indication of the great need that you are filling here at the Resource Center's Dental Clinic.
Exactly, yes.
Thank you again for the opportunity. We hope to visit with you again.
Thank you.
Back over to Steve Watterson. We're coming into the concluding minutes of Share the Vision today on WJTN. This has really been a very wonderful visit, Steve.
Well, it is, and I think, Dennis, your reaction when we first came here a couple weeks ago for the show we did in the School-Based Health Center to the new facility and the new exam rooms, the operatories, the equipment, I think that speaks volumes for how impressive our newly renovated dental offices are, and we hope that we can get anybody out in the community who needs dentists to come in and try us out.
Well, it looks like a room, these operatories, if I'm saying it right, the rooms that you use to see patients, you want to walk in and sit down. I mean, it's that inviting. Radio listeners, it was a dental office, and to my reaction at least was to want to walk in and sit down. But, Brandy, here's the real test for me. 661-1431 is the number to reach you.
Yes, it is. And you can call anytime between 7:30 a.m. and 7:30 p.m. Our clinic is open late hours.
7:30 a.m. to 7:30 p.m. If you're looking for a dentist, dental services, got a dental problem, 661-1431. To you, Steve, to Brandy, to the dentists, to Pam, to everyone who joined us on the air today, thank you for sharing the vision.